Coming up, there are still a lot of questions surrounding COVID vaccines. We'll get the latest information from David Wilson from the National Institutes of Health. Plus, how did the National Indian Education Association convention turn out? We'll talk to Robin Butterfield about their in-person event. I'm Patty Thalahongva. Join us for those interviews, plus headlines from Indian country today.
The Walter Cronkite School of Journalism and Mass Communication at Arizona State University is honored to be a supporter of Indian Country Today. Working with award-winning professors, Cronkite students learn news reporting, social media, shooting and editing videos, and producing content for communications industries. Cronkite's 15 professional programs give students the opportunity to cover critical issues throughout the U.S. and beyond. Learn more at cronkite.asu.edu.
This is Indian Country Today.
Esquili, yes, thank you for joining us. I'm Patty Thalahongva. President Joe Biden's nominee to lead the National Park Service shares his plans to lead the agency if he's confirmed. Chuck Sams III testified before the Senate Energy and Natural Resource Committee on Tuesday. He's been nominated to be the 19th director of the National Park Service. If confirmed, Sams will be the first Native person to hold the position in the agency's 105-year history. The National Park Service employs 22,000 people and generates more than $40 billion for the U.S. economy. The Park Service has not had a permanent director since January 2017, which is the longest lapse in leadership for the agency. It was led by various acting directors under the Trump administration. Sams is Cayuse and Walla Walla of the Confederated Tribes of the Umatilla Indians in Oregon. He brings 25 years of experience in tribal and state conservation and land management to the position. And he's also a veteran of the U.S. Navy. The National Park Service is currently facing many challenges, some that Sams addressed at his confirmation hearing.
The National Park Service cannot achieve its mission without a well-supported workforce, and I'm committed to focusing on the caretaking of this mission. Staffing, housing, and other issues are impacting morale and deserve active attention. I'm also very aware of the concerns about the harassment of National Park Service employees, particularly women, and I have always had a zero-tolerance approach in harassment and will bring this to the position if confirmed.
The committee will hold another meeting to vote on Sam's nomination. If the vote is favorable, his nomination will then go before the full Senate for a vote. A critical hospital in Gallup, New Mexico, is reopening its labor and delivery unit after being closed for nearly a month. At the end of September, the Rehoboth McKinley Christian Hospital closed its labor unit, which sent soon-to-be parents scrambling to find new hospitals. The labor and delivery unit will reopen on October 24th, according to reporting by Source New Mexico. A large number of nurses and OBGYNs had resigned from the hospital, saying they had poor working conditions. The hospital also cited staff shortages for the closure. The hospital serves patients who come from the Navajo Nation, Zuni Pueblo, and other nearby tribal nations. It also serves non-Native patients. Well, buffalo have not roamed the Rocky Boy Reservation in Montana since the early 1990s, and now they're coming home. The Chippewa Cree tribe announced this important cultural event on Tuesday. They say 11 buffalo will be returned to the tribe's pasture. Their return will be preceded by a teepee raising, pipe ceremony, and a community feed. Jason Belcourt is the sustainability coordinator for the Rocky Boy Nation, and he says he's thrilled to have the buffalo back.
And so I believe the buffalo are coming home. They're going to bring some of that spirituality. They're going to remind us about our spirituality. They're going to remind us about our ceremony. They're going to remind us about our language. They're going to remind us of who we are. And once we know who we are, then we're not so susceptible to the social ills that plague our communities.
The buffalo are set to return on October 26th. An unplanned haircut paid for by a teacher has sparked a big dream for one young Indigenous Australian. When Kyle Bambro was 14, he says a teacher paid for his haircut at a barbershop. And after that experience, he decided he wanted to become a hairdresser. And now he's cut hair in more than a dozen communities across the Northern Territory. He is about to complete his hairdressing training and has recently won the Northern Territory Young Achiever Award for cutting people's hair in remote communities who don't easily have access to this service. Bambra has also been nominated for the Australian of the Year award. He knows a fresh haircut can also mean a fresh start, opening doors to employment in communities where jobs and hairdressers are scarce.
I think if we go to communities, sometimes we do a haircut for like 3 hours standing up. I thought it was just going to be a normal hair cutting, but it was literally more than that. So that surprised me, and it's like, oh yeah, I'm actually helping my community.
Bambra is part of a new initiative, Deadly Hair Dude. It offers apprenticeships to Indigenous people and to those with special needs. And those are the headlines for Indian Country Today. I'm Patty Thalahungva. Coming up, we'll give you more information on the COVID-19 shots and COVID vaccine information for children.
And Indian educators and students plan for the future. We'll be right back. There are a lot of questions about the COVID-19 booster shots and its effectiveness. In 2017, David Wilson was named the first director of the Tribal Health Research Office and the U.S. National Institutes of Health. He has also collaborated with Dr. Anthony Fauci since the start of the pandemic and has addressed tribal leaders about their concerns. David has worked in the U.S. Health and Human Services Department. He teaches at the Center for American Indian Health at Johns Hopkins University. Welcome, David.
Hello, Aaliyah. It's a pleasure to be here with you today.
How have you ensured that tribal nations have information about the coronavirus?
Yes, thank you. That's a really important question. And during the early stages of the pandemic, one of the important things that the NIH did is that we held a rapid response consultation for tribal leaders to provide the input about how they would like to address the COVID-19 pandemic in their communities. And as a result, the agency received guidance on how best to construct research programs and efforts to address the needs of tribal communities.
And I want to be clear for our audience, you work specifically on the research side of health and what that means. Can you tell us more about what your role is specifically, maybe what we could find you doing every day?
Absolutely. So I am the director of the Tribal Health Research Office, which coordinates the research that happens across the 27 institutes and centers at the National Institutes of Health. So it's a wide array of biomedical research that occurs that addresses all the different situations, conditions that plague our tribal communities. And so COVID-19 being one of the impending public health emergencies, that's really what our focus has shifted to as of late. So we've been working extensively with our partners at the National Institute of Allergy and Infectious Disease, which is the home for Dr. Tony Fauci, but also other sister agencies such as CDC, the Indian Health Service, and other federal partners.
And what kinds of research are you specifically looking at?
Great question. So in the early stages, after our consultation, we were able to work out parameters for other tribal communities to want to participate in some of the COVID-19 vaccine clinical trials that were launched. And we had great success in that. Some of the things that came out of this were groundbreaking data sharing and biological specimens agreements. They were created between tribal communities and COVID-19 pharmaceutical companies, which really allowed the tribal communities to want to participate, but not only participate, to conduct COVID-19 clinical trials in their own communities in a respectful and culturally appropriate way.
And about those vaccine trials, I know that I've reported on Pfizer including Native communities in their clinical trials. Did the Johnson & Johnson vaccine and also the Moderna vaccine also include Native communities in that trial?
Yeah, that's a terrific question. These were two of the pharmaceutical companies that launched their efforts early on during the phase or in the early days of the pandemic. So because of the consideration that we want to take when we engage tribal communities, those studies moved so far and so fast, it was really hard to appropriately include tribal communities in these trials. But we did have terrific success with the Novavax company, which was one of the trials that had launched later during the pandemic, where we had the opportunity to really have these productive discussions with tribal leaders, with tribal communities, and with the pharmaceutical sponsors. And that serves as a model today of how tribes should be included in biomedical research and phase 3 clinical trials.
The White House this morning announced that it has a plan in place for when COVID vaccine trials, of course, are granted emergency use authorization for children. Tell us about Native children and COVID. Are you collecting data on that, and specifically about Native children and vaccines?
Yeah, absolutely. So as a parent of a child who's under 12, I'm also anticipating the opportunity to protect and keep my child safe. And COVID-19 vaccine for children is definitely within reach. So we're really looking forward to that. We should have a lot more information very soon. The FDA and the CDC will be holding public meetings in the next couple of weeks to review the data that they've received to ensure the vaccines are safe and effective. And just remember that all of this data and information is public. It's available to the public. And it's also important to consider that the final determination and timeline will be based upon the FDA's processes. So I think that having a vaccine before the end of the year is within reach, and kids will be safer when it is available.
On the topic of vaccines, I know that tribal nations have had very large rates of vaccinations for citizens, but of course there still is that vaccine hesitancy that we're seeing all across the country. Are you doing any research about vaccine hesitancy and maybe how to combat that as well?
This is something that we can definitely do a lot more in. And one of the ways that the NIH is addressing this is through one of our efforts called the Community Engagement Alliance Against COVID-19. And this is a program that includes a diverse ecosystem of partners and trusted leaders from across the country. So not only are there members of the research community, but there's also policymakers, faith and community-based organizations, and professional foundations that are a part of this SEAL effort. And our ultimate goals are to build and enhance COVID-19 awareness and education, and also education around the research that's happening, and support an expanding community engagement in terms of the public health response to COVID-19. And also establishing connections and networks where members of the public can go immediately to find and identify trusted and accurate sources of information related to the pandemic.
I want to wrap up on COVID and then move to other topics. But before we do that, I want to make sure that I give you the space to address maybe anything that you want Indian country to know specifically about COVID-19 and the research that you're doing.
Yeah, absolutely. And thank you for that opportunity. What I want our people to know who are watching currently is that you definitely have the power to help save lives in your community. Not only in your community, but with your friends, your family. And it's important to get your accurate information out to your friends and family. So when people don't have accurate information or are misled by something that they see on social media, it really turns them away from making decisions that could potentially save their lives. And we have to fight against that. And we do that by sharing the truth, by sharing our experiences, and by pointing to people and to credible sources that are out there.
As we mentioned before, you oversee thousands, if not hundreds, of studies about Native people, and you have a research budget of $130 million. Aside from COVID, can you tell us what other research initiatives you're working on?
Absolutely. So across the NIH, we are really preparing for what comes after the pandemic. Because of isolation, we've heard and we've seen a lot in our communities what isolation has done. And so there's going to be a wave of issues related to mental health conditions. We're already seeing a rise in issues related to suicide and also substance misuse. So these are all really important factors that really are detrimental to our communities. So it's important to better understand how we can treat members of our community to address these conditions so that we can have better communities across the country.
And Indian Country Today has actually reported on that these issues of isolation and mental health are not only affecting, I guess I should say that they're affecting wide ranges of ages. We've reported on teens, young people, middle-aged people, and of course, elders. Is that right?
Yeah, absolutely. Isolation is a phenomenon that's not specific or unique to any age range. So it's really important to pay close attention. One of the things that we've done is we've held conversations and interviews with Dr. Josh Gordon, who's the director of the National Institute of Mental Health. And he has shared what they've been currently seeing across the country and how what we are learning from research that's happening across the country, how that can be applied to tribal communities to make sure that we pay close attention and we're able to identify our community members who are in need of help.
What about existing health conditions that Indian Country faces, like diabetes and other, I guess, areas of public health? Are you currently doing research on that as well?
Yeah, absolutely. There's a tremendous effort from several institutes at the NIH, and our goals are to really address this. What the pandemic has really shown us is it's demonstrated that these underlying conditions really contribute to very poor outcomes of those individuals who are infected with COVID-19. So thinking about what comes next, what is going to be the next public health emergency? And we have to begin now to answer those questions, to heal our community so that we are not in the same situation when the next public health emergency arises.
And that's something that many experts are anticipating and have publicly said is something that they are looking out for. We'll definitely have to check in with you in the future to talk about, as this pandemic progresses and continues in time, sort of what we're seeing.
Absolutely. Always look forward to that. Our office serves as a single point of contact for all tribal communities. So if there's ever any questions, we would be happy to respond to those.
David Wilson, thank you so much.
It's a pleasure to be with you today. We look forward to the next engagement.
When we come back, we'll break down the National Indian Education Association's conference. The National Indian Education Association returned to an in-person convention last weekend. 800 people gathered in Omaha, Nebraska for the convention. 200 of them were students. Joining us today is Robin Butterfield, a longtime educator who now works with the organization. Also joining us is ICT's Shirley Snavy, who filed the report earlier this week. Welcome. Robin, let's start with you. What were the big takeaways from the conference?
Okay, well, I think one of them was that, American Indians, Alaska Natives, and Native Hawaiians are community people. And so it was really a wonderful opportunity for us to gather personally. Last year, we did a virtual conference. I think some of the big takeaways for me was with that large number of participants that you just mentioned, every one of us was wearing a mask for the entire duration of the convention. So we are very conscious about, the health and welfare of our communities. I think secondly, we had a student strand, which I think Shirley is going to talk a little bit about in more detail. We also had quite a few workshops that were focused on trauma-informed care and dealing with, the sort of resurgence of talking about the boarding schools that our Native people have had to endure and the trauma that it has left with all of us. And then I think also we had workshops that focused on the inclusion of history and culture, which also is something that we just wrote a resolution about. And then the 4 critical resolutions, I think we're going to talk about in a few minutes. And then finally, we had kind of a major ceremony for handing off the Honoring Tribal Legacies program to NIA. That was a program that was funded over the period of 10 years by the National Parks Department and ended with the creation of a couple of books that documented the over 100 meetings with tribal members, focusing on the Lewis and Clark bicentennial. And out of that came a whole series of lessons for classrooms, which now will be housed at NIA. So Honoring Tribal Legacies was a ceremony that we went through during the convention.
Shirley, I understand that you reported on the youth section of the convention, excuse me.
That was really exciting to see so many young people gathered together and really interact and just have a great time. Frank Wan and Chance Rush were the facilitators for the 2-day conference. And, Frank is they're both just such fine individuals. And to hear the way that they inspired the youth was inspiring to me too. So I was really happy to have a chance to be there.
Robin, I want to go back to you. Tell us, how did this convention feel, look, and in general, how was it different?
Well, actually, it wasn't that different other than the numbers and, the ability of people to get there because of COVID. But I think the organization has moved over the period of the last few years into trying to emphasize more membership participation. So NIA has regular membership calls. We have committees now that participate around different issues and infrastructures with the organization. So having members take a more active role in advocacy, I think, is one of the goals, so that we hear the voices of all our people and that we feel the integrity of taking their messages to wherever they need to go, whether it's at the local, state, or national level.
And Robin, tell us about the resolutions that were passed.
Okay, well, this year we passed 4, and I'd like to also state that the affiliated tribes of Northwest Indians and the National Congress of American Indians have also passed our same resolutions, because NIA often operates as the education arm of the National Congress. But we had 2 resolutions that were focused on sort of changing the focus of funding. One with impact aid funds, which are funds that are dedicated to schools that are on or near reservations. And the other one, trying to expand the opportunity under the Indian Education Act for professionals to get doctoral degrees. I guess they could always have gotten doctoral degrees, except the catch-22 is that you have to be a full-time student. And oftentimes when you're a doctoral student, you don't have those kind of credit hours. So in effect, it was eliminating doctoral candidates from getting funding. The other 2 resolutions are in response to things that have been happening in the news most recently that are not only impacting students, but impacting the educational process. So we have one resolution that I'll just read the heading of it, if that's okay. It's in support of teaching the full and accurate history in the United States. And it's the result of one of our staff members has done a research on how many states have been passing legislation. And as of July 15th, 26 states have introduced bills or taken steps to restrict instruction of the full and accurate history of the United States and to limit discussions of racism, sexism in the classroom. And We just got a notice yesterday that the ACLU of Oklahoma is filing a lawsuit, I should say, challenging one of those states, which is Oklahoma. It's House Bill 1775, which severely restricts public school teachers and students from learning and talking about race and gender in the classroom. And the director of the Oklahoma ACLU has said this, and it's a quote: "Education is a tool of empowerment put to its highest use when teachers and students are afforded the full scope of their constitutional rights to engage in comprehensive, meaningful, and sometimes difficult conversations." House Bill 1775 is a direct affront to the constitutional rights of teachers and students across Oklahoma by restricting conversations about race and gender at all levels of education. We bring this case to vindicate the rights of Oklahoma teachers and students and to protect the integrity of our educational institutions. So they basically are declaring that the bill is unconstitutional under the First and 14th Amendment.
Great. And our viewers can actually find more about this reporting on our website at indiancountrytoday.com. Robin Butterfield and Shirley Snavy, thank you so much. And that's a slice of our Indigenous world. Thank you for watching. For all the latest news, go to indiancountrytoday.com. I'm Aaliyah Chavez.
Sometimes you got to take a stand just because you know you can. Oh, you got to run, you got to run. Standing
This is Indian Country Today.